Today in our Nursing Mindset series, we're going to focus on another important responsibility nurses have, protecting tissue integrity. Now, as you can see from the graphic, the key message is simple. The best wound is the one that never develops. Now, while nurses certainly care for wounds every day, our greatest impact comes from preventing tissue breakdown before it even starts. Let's walk through the nursing mindset for tissue integrity. First, recognize risk. Every patient is different, and some patients are much more likely to develop impaired tissue integrity than others. Think about patients who are immobile, have poor nutrition, decreased sensation, moisture from incontinence, or poor circulation. These patients require extra attention because they are at a higher risk for developing pressure injuries. Now, one tool that you'll learn to use is the Braden scale. The Braden scale helps identify patients at risk. Remember, the lower the Braden score, the higher the patient's risk. Next comes assessment. A thorough skin assessment is one of the most valuable things a nurse can do. Don't wait until a wound develops. Assess your patient's skin early and often, paying close attention to bony prominences, areas under medical devices, changes in skin color, temperature, moisture, and any signs of redness or skin breakdown. The earlier you recognize the problem, the sooner you can intervene. The third step is documentation. As nurses, we document what we observe, not what we assume. Objective documentation allows the healthcare team to recognize changes over time and determine whether the patient's condition is improving or worsening. In class, we'll practice using margaritas and tacos, both acronyms, to help organize a complete wound assessment. These tools help ensure your documentation is thorough, consistent, and communicates exactly what you observe. Now let's talk about prevention, because this is where nurses make the biggest difference. Notice the 4 prevention priorities on the graphic. First, reposition patients regularly and offload pressure from bony prominences, especially the heels. Second, protect the skin by keeping it clean and dry while minimizing friction and shear. Third, optimize nutrition. Wounds need protein, calories, hydration, and adequate circulation to heal. Without those building blocks, healing slows dramatically. Finally, promote mobility whenever possible. Even small amounts of movement can reduce prolonged pressure and improve circulation. Remember, prevention is almost always easier than treatment. Finally, we come to evaluation. This is a step that sometimes is overlooked, but it's one of the most important parts of the nursing process. Ask yourself, did my interventions work? Were my goals met? Is the patient's skin still intact? Has the wound improved? Has the patient's pain decreased? Are there any new signs of infection? If the answer is no, it's time to reassess, modify the care plan, and continue collaborating with the healthcare team. As you can see on the graphic, our desired outcomes are straightforward. Maintain intact skin, prevent new pressure injuries, promote wound healing, prevent infection, control pain, and reduce the patient's overall risk. I'd like to leave you with one final thought that's highlighted at the bottom of the graphic. Treat the cause, not just the wound. Addressing alone won't heal a pressure injury if the patient remains on the same pressure point all day. Likewise, a wound won't heal well if nutrition is poor or blood flow is inadequate. As nurses, we must always ask ourselves, why did this wound happen? When we identify and address the underlying cause, not just the wound itself, we give our patients the best opportunity to heal. So remember the nursing mindset for tissue integrity. Recognize risk, assess, document, prevent, evaluate. Because at the end of the day, the best wound is the one that never develops. That's the nursing mindset. Keep developing yours.